have received a total of 1,078 results, out of which 120 samples tested positive. 68 are males and 52 females. The ages range from 1 year to 84 years. The distribution is as follows. Windhoek, 72. Walvis Bay, 8. Swakopmund, 18. Gobabis, 10. Okahanja, 3. Mariental, 2. Grootfontein, Rehoboth, Keetmanshoop, Karasberg, Loderis, Oshikuku, and Oshakati, 1 each. Of the 72 cases reported from Windhoek, 13 are from Windhoek Correctional Services. It is therefore imperative that people in secluded places like prisons, holding cells, hospitals, hostels, police camps, military barracks, etc., observe more precautionary measures, as the risk of fast transmission to a number of people is very, very high in those settings. Since the 12th of August 2020, we have been observing a downward trend in the number of cases from the Orongo region, especially from Walvis Bay, with cases declining from 97 to 26 today. It is our hope that the curve is starting to come down. However, we should not lower our guard yet. We need to be more motivated to adhere to preventive measures for this dream to come true. I know compatriots in Orongo, especially in the restricted area of Walvis Bay, Swakopmund, and Aranda's local authority areas, have really endured a lot of hardship as a result of measures introduced to curb the transmission. These measures may just be bearing fruits. 10 cases reported from Mamaheke region, Gobabis districts as follows. 9 are contacts to the same confirmed case, as they live in the same household. 1 case is that of 84-year-old female from Aminus, with no known contact to a confirmed case. She was tested on the 13th of August as she presented with COVID-19 related symptoms. She has multiple comorbidities and is currently admitted at the Gobabis Hospital. We have observed with concern the rising number of cases in the Mamaheke region since the 7th of August 2020. This calls for increased vigilance throughout the country in order for us to stem the tide. 4 cases reported from Otjozondjupa region as follows. 3 are a 42-year-old female, a 36-year-old male, and a 24-year-old male, who are all residents of Okahanja, all presented with COVID-19 related symptoms. 1 is a contact to a confirmed case. The remainder 2 commute daily between Windhoek and Okahanja. 1 is a student, while 1 works in Windhoek. The case from Grootfontein is that of a 36-year-old female who was tested on the 11th of August after she developed symptoms consistent with COVID-19 on the 3rd of August 2020. She reported no contact with a confirmed case and has no travel history. 3 cases are reported from Hardap, 1 from Rehoboth and 2 from Mariental districts. The case from Rehoboth is that of 48-year-old female with no known contact to a confirmed case. She was tested on the 15th of August as she presented with symptoms consistent with COVID-19. Of the 2 cases from Mariental, 1 is a 50-year-old female with no contact to a confirmed case. She was tested on the 13th of August as she presented with symptoms consistent with COVID-19. The other one is a 36-year-old male, a healthcare worker, who was tested as part of active case search. He does not have known contact to a confirmed case. 3 cases are reported from Karas region, 1 each from Keetmanshoop, Karasberg, and Lourdes districts. The case from Keetmanshoop is that of a 30-year-old male, a healthcare worker, and a contact to a known case. He had been in a quarantine. The case from Karasberg is that of 27-year-old female with no known contact to a confirmed case. She was tested on the 10th of August as part of active case search. She works at the quarantine facility. The case from Lourdes is that of 51-year-old male with no known contact to a confirmed case. He was tested on the 16th of August as part of expanded targeted testing. The case reported from Msati, Oshikuku district, is that of a 33-year-old male from Okaku area. This is also in the district of Oshikuku. He was tested on the 11th of August because he presented with COVID-19 related symptoms. He was admitted in an isolation unit on the same day. While awaiting for the result, he actually traveled from Windhoek on the 6th of August and was in contact with a known case in Windhoek. Of the active cases, 14 cases are in severe sick condition, while 4 are in critical condition. They are as follow. In Erongo, the number of severe cases, there are 6. In Comas, there are 8, totaling 14. In Erongo, 1 case is in a critical condition and 3 in Comas region, totaling 4. So altogether, we have 18 cases. I am pleased to announce that 28 cases from Comas have recovered. Fellow Namibians, the devastating effect of COVID-19 pandemic continues. Sadly, another life was lost in Oshana region. This is a 65-year-old male, a resident of Ngwediva, originally from Outapi, known to have multiple comorbidities. He was admitted and tested on the 4th of August 2020 at a local private hospital as he presented with symptoms consistent with COVID-19. The result came out positive on the 5th of August. However, on the 15th of August, his clinical condition deteriorated rapidly and he passed away on the 16th of August. We express our sincere condolences to the bereaved family. In summary, currently we have 4,464 registered COVID-19 positive cases since the beginning of the pandemic, and we have 2,407 recoveries. The number of active cases stands at 2,020, and the death toll has increased to 37. We have so far tested 42,945 samples. The active contacts is 4,647. We have quarantined thus far a total number of 8,186 people in Namibia and discharged 6,589. And currently, we do have a total of 1,597 people in our quarantine facilities. This concludes today's update, and I thank you.